Welcome, doctors. I'm excited to share this information with you on optimal recovery and performance, advanced laser therapy strategies. Now, don't let that title get you intimidated. Even though it says advanced laser strategies, we're going to use some very simple and easy to do laser strategies here that you can do right out of the box on day one. My goal is to make this something you can do without having to overthink it too much. So one of the things I want you to think about as we're talking about these lasers is that look at the words of Nikola Tesla. That he said, if you want to find the secrets of the universe, think in terms of the energy, frequency, and vibration. And we look at Erconia lasers. Erconia lasers are the highest energy lasers. There are 22 unique FDA clearances. Now, that's very important because while other devices do have FDA clearances, many of them are not unique. They are as an equivalency type of a clearance. It means they didn't do any research on their particular specifications. Erconia has done that 22 different times to get these unique clearances. And you can do up to 8 frequencies at a time if you're doing, say, an FX 405. FX 635, you can do 6. And in all the handhelds, you can do 4 pulse frequencies at a time. Important for you to understand the difference between the Erconia lasers and, say, a class 4 infrared lasers is that energy is determined by the wavelength, which is the color of the lasers. It is not determined by the watts. Increase in the wattage does not change the energy of the particular laser. What changes the energy is the wavelength, which is the color. And let's get into how this affects what you're going to do with your lasers. First of all, when we look at the Erconia lasers, I love to call them as being like your handheld lightsabers. These are the highest energy non-thermal lasers in the galaxy. So when you look at the violet wavelength is the highest energy laser that's non-ionizing that can be used for therapies. It is 3.1 electron volts. Green is 2.4 and red is 1.9 electron volts. Now that's an important threshold to understand because anything that falls below 1.7 electron volts, which would be all of the class 4 infrared lasers, they're going to have lower energy on below that 1.7 electron volts. Why is that important? It's because then the laser works differently. This is why you see different wattages being used with those devices. And when they try to ask, well, why is an Erconia laser only at this many milliwatts? It's underpowered. If we were to use the same kind of wattage that's used with a low energy wavelength, we would literally burn through the flesh and rip a person to shreds. This is why we have them at the safe thresholds here. And when this laser gets on the body, you're going to trigger these electrons to jump into higher orbits. And then when they do that, as it falls back down, it's going to create a whole cascade of photochemical reactions, enzymatic reactions, and it gets amplified. Every second one of these lasers is on the body, you have quadrillions of photons hitting the skin, triggering quadrillions of reactions. This is how we can do big things with small dosages, even in very short times. So when we look at key concepts, a lot of doctors get confused of the differences of the wavelength. So these next 2 slides, you'll probably want to pull out your phone and take a picture or a screenshot of this. If you want to be a laser Jedi master and be able to impact complexes 1, 2, 3, and 4 of the electron transport chain, you got to use more than one wavelength. Violet has wavelength specific reactions at the first 2 steps in making ATP. Green has wavelength specific reactions at complex 3, and red and infrared can affect complex 4. But if you want to hit all of them, you ideally want to have all of the wavelengths of the lasers. And why do we want to do that? It's because it's going to impact the function of mitochondria. Why do we care about mitochondria? This is important for you to understand to see how if you had a patient coming in for pain, like neck pain, shoulder pain, back pain, etc., you get the lasers on these patients and you're impacting their mitochondria. You're dampening inflammation. What does that affect in the body? Virtually everything. Patients will show up in your office with things like skeletal muscle and movement disorders, and poor mitochondrial function can be a trigger for that. They may also have metabolic disorders and diabetes. How many of your patients have that? And poor mitochondrial function can impact that. Cancers, cardiac diseases, neurodegenerative diseases, pulmonary and respiratory disorders, vascular diseases and atherosclerosis, aging, dystrophies, renal diseases, and neurological disorders and autism. Any of these can be impacted by poor functioning mitochondria. So if you get a laser on the patient, you can help to provide support for these conditions. You're not necessarily treating those conditions, but understand if you're treating them for something the device is FDA cleared for, you may see some improvements with these other conditions as you're improving the function of mitochondria. Now, what are some symptoms of mitochondrial dysfunction? Well, look at these things that commonly come into your office: hypotonias, weakness, cramping, muscle pain, migraines, neuropathic pain, peripheral neuropathies, gastrointestinal problems, optic neuropathies, fatigue. So many different things can come in and be the result of a mitochondrial dysfunction. And what are the things that can trigger mitochondrial dysfunctions? Well, one of the big things going on right now, when you see studies talking about long COVID, and there's recently the Yale study called the Listen study, talking about not only long COVID, but what's the impact of mRNA vaccine side effects. And one of the targeted structures of the body is the mitochondria. They're saying this could be a potential cause for long COVID. And so, again, getting the three wavelengths on the body can help with the mitochondrial function and potentially support these patients for long COVID. And when we go back and I mentioned that Yale study, the Listen study, go to yale.edu and look at the Listen study. They're going to talk about the common symptoms, long-term symptoms from the vaccine include brain fog, exercise intolerance, fatigue, overall generalized pain, cardiovascular issues. Those are just a few of the things that we're seeing patients have following the mRNA vaccine. So things have changed a lot in the office, and you've got a lot of patients coming in with brain fog and chronic aches and pains. Your laser can help provide support, and all you've got to do, it's very simple, get the laser on the body. I'll show you some demos here in a couple of minutes. A common thing that can inhibit the electron transport chain and impair mitochondrial function is this. Take a look at your patient's health intake and their history and look at, are they taking pain relievers like NSAIDs, aspirin, indomethacin, diclofenac, piroxicam, and ibuprofen? Are they taking common meds like metoprolol, statins, antidepressants, Prilosec, Cymbalta, gabapentin, and many more? These can disrupt the mitochondria. If we look at these food factors, let's take a look here. How many of your patients are exposed to any of these things in their foods? Glyphosate or Roundup, artificial sweeteners and colorings or dyes, high fructose corn syrup. If you're watching this and you're in the United States, that's in so many of our foods and even in medications and medical foods. Other common pesticides and herbicides on non-organic foods, vaping or smoking, hydrogenated vegetable oils. Sometime go read the ingredients in Ensure, Boost, or Glucerna and some of the foods recommended to diabetics and to stroke patients. And you'll see it's loaded with this stuff, making them worse. How about the COVID spike protein and alcohol? So any of these things can negatively impact your patients. You can have them do exercise, you can do supplementation, you can also get them on lasers to help with these conditions. So when we look at this is an important thing for you to understand to see why we recommend utilizing all three wavelengths if you can. Now, if you can't, I started with a red laser, and then 4 years later, in 2008, I upgraded and got the base station where I had an EVRL and two accelerates. And then when I was doing the research on the GVL, added that in as well. So this is again showing you those first two steps in the electron transport chain are wavelength dependent on violet lasers or violet wavelengths. Third step is green, fourth step is red or infrared. And this is what you can utilize to cause these electrons to jump and trigger photoelectric, photosignaling, and photochemical reactions. If you have a class 4 laser that's infrared, they don't do that. They do photothermal and photomechanical. So they are completely different lasers. That's why we use them in a different manner. Important way for you to understand this and also to help your patients understand is this. They ask you, why are you using a violet laser or a green laser or a red laser versus infrared is this one? If we put these patients for the same amount of time and same amount of dosage under the UV tanning bed on the left or the infrared lamp on the right, will we get the same impacts? No, we're going to get totally different impacts. On the right side, even though that UV light only penetrates a few microns, it's going to trigger a photosignaling reaction to cause your body to make vitamin D, which will then affect it globally, not just in the area where the light was applied, but you're going to get all the way down to the depth of the bones. You're going to get some bone strengthening there, and you'll get the anti-inflammatory and immune supportive effects of vitamin D globally. If you're on the right side with the infrared, you're going to get some great benefits with infrared, like for detoxification and muscle relaxation. But no matter how high you turn the wattage up on that device, you can never ever trigger melanin production or vitamin D production. That's very important to understand. It's an easy way for patients to understand this too. And also because you'll see some companies will say, "Ah, we can do the same thing that that Erconia laser does for their FX. We can do it in 1/20th of the time because we're 20 times more powerful." Well, that's not accurate because it's a different wavelength. So different wavelengths have different impacts on there. And the case in here is showing you what if a baby has jaundice? What color light do you put them under? You don't put them under a green light or a red light or an infrared light. It's blue light. And does that penetrate all the way to the liver? No, it doesn't. But it creates a cascade of enzymatic reactions that help support liver function and knock out jaundice. So those are some basics for you to understand. And this is another slide I recommend you to take a screenshot or a shot with your phone on here, because the biggest thing that both patients and doctors get confused about is what are the unique applications of each color of laser. Now, many of them will overlap. Like any color wavelength of laser is going to be anti-inflammatory and can help to improve some blood flow, but some are going to do things better than others. So when you're utilizing the violet, one of the biggest things it does is it's great for antimicrobial support. That's where the violet wavelengths that Erconia has have specific clearances for the bacteria that's involved with acne and for the fungus in onychomycosis for nail or toenail fungus. Scar tissue breakdown is superior when you utilize the violet wavelength laser because you have that higher energy. You've got that 3.1 electron volts, which triggers more reactions and it's better at breaking apart scar tissue. Any of them can do it, but that's just the better one. You can also stimulate vascular endothelial growth factor, which is great for repairing blood vessels, to improve blood vessel function and cardiovascular function. And when utilizing violet and red together, we get a nice balancing effect of the parasympathetic and sympathetic nervous system. We used to say that one was more stimulatory for the parasympathetic and one was more stimulatory for the sympathetic, but what we're finding is they really work synergistically to kind of have a calming effect on the body. When we look at the green, there's a lot of research on green lasers in uh, cosmetic types of procedures. And that's because green is great for stimulating collagen, elastin. You can stimulate chondrocytes, stem cells. The green has perhaps the biggest impact on stem cell production and also on bone and nerve regeneration. Now, if you go into PubMed, there are not as many studies on green lasers, but those are some of the studies that we're seeing. The preliminary findings are suggesting that it is better for those types of conditions. Red is the best for the final step in supporting ATP production in the energy chain. You'll also support interleukin 10, which is great when patients have autoimmune reactions, like we commonly see with long COVID or with the mRNA vaccine reactions. Interleukin 10 is like a regulator for the cytokine inflammatory responses. So you can calm that down. You'll also support T regulatory cells, which again can support patients when they have autoimmune functions. And you get that sympathetic, parasympathetic support and cell proliferation. So best is to use all three. If you're starting with only one laser, let's say you're brand new in this, you want to get one handheld, my recommendation is go for the GVL. Go for either the GVL or the EVRL. I'm going to lean towards, if you're going to choose just one, saying go for the GVL because Dr. Silverman and I have the most experience of anyone on the planet with these lasers since we've been using them since 2019. We started doing the clinical trials. The results are by far superior when you use that combination of wavelengths, especially when you look at the 24 and 48-hour follow-up marks on there. So that to me is the biggest one you'd want to start with. What's exciting right now, before we get into how to utilize these lasers, is how laser awareness and demand has changed since 2004 and even 1974. So, why do I say 1974? Well, that's when Russia already had lasers as part of their state-sponsored standard medical care. When I started in 2004, people thought I was crazy when I called my office laser chiropractic. But now we're seeing the buzz around laser and light therapies. And if we look at it for aesthetics, like we have the VZ8, the brand new laser that just came on the market for body contouring, which is the most effective device out there, and in the shortest time. It's only 20-minute treatment protocols on there, and you get all the wonderful benefits of violet wavelengths of lasers on top of it, like the decrease in pain, the dampening of scar tissue, the immune support. These are projected to grow a lot in the next 5 years. As a matter of fact, we're looking at the global laser therapy market is projected to grow from a $3.1 billion industry to $4.39 billion industry. And then we look at patient awareness. What are people searching for online? We're looking at the amount of searches have increased 23% for photobiomodulation. And in the past year, we're seeing Red light therapy has increased 81%. So it's getting in public perception in their mind. And the wonderful thing is, I'm going to show you how lasers blow red light therapy out of the water. So it's not even close. So I got invited to come out and to go to the Lakers training facility, which was like a dream come true for me. I've been a lifelong Lakers fan, and when I showed up there, Kurt Rambis, who played in the Showtime era Lakers with Magic Johnson, won all those championships, he comes out and asks me, "Hey, what's the deal with these lasers?" And so instead of lecturing him about it, I said, "Well, let me try something on you. What do you got going on?" He had a shoulder injury where he couldn't bring his arm up very high, and he had constant chronic pain in the shoulder, this throbbing pain. I did a 10-minute treatment on him with the FX 405 and the GVL stacked into there together, had him do little small range of motion movements that anybody can do on day one. He gets up after 10 minutes, he had improved range of motion, and the throbbing pain was gone. So he had me work on the other trainers, and particularly on the strength coach, Randy Flores. And Randy had no pain when he was there, but I had him uh, ask him if there's anything that was bothering him. And he said when he would do squats, he would have severe knee pain and he couldn't squat his normal weight. So I did laser on him. I did a little advanced protocol, a neuro recalibration protocol. If you come out and see me live, we'll get you into workshop groups to do this one. It's really awesome and generates a lot of referrals. But I did that on him. He went and did some squats that night and he talked to me later, said, "Dude, that was amazing. I had no pain. I was able to do my max again." Talked it over with Rambus and with other trainers. We want to guinea pig my wife. This is his wife. This is Bethany. And what Bethany did is Bethany was a professional CrossFitter. And she had chronic back pain since she was 12 years old. She was a gymnast and she had been living with it. But it got so bad that a couple of years ago, she couldn't compete in the CrossFit championships. So they wanted me to guinea pig her and to see what we could do with stacking the FX and the GVL. And so Bethany came in twice a week for the FX in the office. We did the standard 20-minute protocol that is pre-programmed. So anybody can do this on day one with your FX out of the box. And I'll show you some videos of it. You stick the laser on the back, you push the button, and we stuck the GVL into where it can dock into the FX, and we did a 20-minute protocol. And then she rented the green and violet and took it home over the next approximately 8 weeks and would use it at home several times a day. Now, Bethany had been to chiropractors, physical therapists. She had a home red light therapy kit. Nothing was working. She wasn't going to be able to compete in the CrossFit games. So she tried this. She said if she could drop it down by a one, she'd be ecstatic. We got her down to a zero. We got her out of pain within like approximately 8 weeks before the CrossFit games. She also said it took care of plantar fasciitis and some neck pain that she had as well. And the cool thing is when she went and she competed in the CrossFit games, she actually came in 15th in the world, which was amazing. So then the next year, she came back in, and this time she's not really in pain. She did notice when she wasn't getting regular laser therapy that her performance wasn't as great. So she said, "Hey, I want to rent that laser again." She rented the GVL and utilized it for a couple of months leading up to the event. And what was really awesome is that this time she competed not only with no pain, but she finished number one in the USA and number four in the world. The protocol we did for this. So take a screenshot of this or ask for my slides. You can send me an email to Dr. Garrett Gmail. That's DRGAIR at Gmail, and I'll send you out my slides for this. Sample protocol for it is it's just 7 to 20 minutes that you're going to do on there. So we had more time. We did the 20-minute protocol with the preset on the FX. And then for the GVL, we use these settings 8, 25, 42, and 279. Or you can use 1, 10, 40, and 60. At home, she would do it 2 to 3 times a day for 10 to 20 minutes. It could go for up to an hour. Really great results. And here's a cool thing for all of you that already have Erconia lasers or who are looking into getting them. Make sure you follow Bethany on Instagram. She has over 500,000 patients or people, sorry, following her on Instagram. And she's agreed now to partner with us for the next 3 years. And she's going to be doing promo videos of her utilizing the lasers while she's training and talking about the lasers and videos. So this is going to create massive, massive brand awareness. And patients are going to be looking for doctors who have the Erconia lasers and know how to use them. So it's great for all of you here watching this webinar. So one other thing that we'll do with these lasers is do performance enhancement. We can do it for vision or just for general performance. And this is what the lasers will do. This study here said that when athletes get laser before they do their activities, they perform as if they've taken performance enhancing drugs. They have bigger muscles, takes them longer to fatigue. They're able to repair faster as well. And this study actually said they weren't sure lasers should be allowed in international competitions because it seemed to give these laser athletes an unfair advantage, which who doesn't want an unfair advantage? Whether it's an elite athlete or a pickleballer or a golfer, we all want to do our best and beat our friends. And this is what
Mitchell is a name widely known across our sports community.
what Dr. Michael Trafford did at his centers and in South Carolina, in Asheville. He's got the Apex Brain Centers, and working on this gentleman, Mateo Mitchell, he was an Olympic, already had medaled in the past in the 400 in the 4 by 400, and now he's doing the bobsled. He would come into Dr. Trafford's clinic to enhance his sports performance, and you're going to see that what Dr. Trafford had him doing is different brain exercises, and then stacking the laser on top of it. And with that, he can enhance his reaction time. His speed is better. We've done this with athletes, just lasering the brain, where we'll see athletes be faster, throw the ball harder, etc. It's very easy to do. You don't have to have a diplomate in functional neurology. If you do, you'll do even better. But if you don't, you literally get the laser on the brain, have them do cardinal fields of gaze, eye tracking on here, fixation on an object, and you can do balance exercises, put them up on a vibration plate while they're being lasered, and you can enhance their sports function. And you'll see here in just a moment how he's going to have it on Manteo's head here. Let me skip forward here so we don't have a ton of time. There you have it, where he's just sitting in a room with the laser on his brain and he's utilizing this and he notices the improvements that he's got with that. So let's look at what that looks like. If you go on to the internet and you want to see the whole video or share it with your patients, just search that there, Olympian Mateo Mitchell embracing brain training, and you can share this with your patients. The protocol that we do is this, is just you get the laser on the brain, use Dr. Trevor Berry's basic brain frequencies on the brain, do that for somewhere between 5 to 20 minutes. You can also, instead of doing it all in the brain, what I do in my office a lot is have the patient lie down face up. We'll get one laser on the brain and spread out the FX all the way across the torso and down to the legs. Now, this doesn't only work well for athletes, but you can also use it with just a patient who's feeling fatigued, run down from COVID. They've got brain fog, they got generalized body aches, they got fibromyalgia. It's a good protocol you can use for that. So I love utilizing the FX in these cases because one of the advantages is you can do these large areas and you can stack. The GVL fits perfectly in there. Patients love the way it looks. They'll take selfies under it. They'll share it on social media for you. So there's free built-in marketing. And the cool thing is this is the only laser that has a full body clearance from head to toe. So anywhere we use it, we can justify what we're doing because you got that head to toe FDA clearance for pain and inflammation. This is what it looks like as well. This is Dr. Ryan Manning, where he's treating Ian Somerhalder, who was the actor in Lost and also in The Vampire Diaries. And there you can see Dr. Manning is stacking the lasers along with doing some myofascial release. So you can stack that together. That will loosen up the tissue a lot to make your adjustments easier and dampen inflammation for this patient. Very, very easy to do. Now, you can also, cool thing is, here's the new device, the VZ8, which has the greatest circumference loss out of all the lasers that we have out there. It beats pretty much anything out there in the market, and you can do it in a shortened time frame, in only 20 minutes. Doctors are also utilizing this for pain. So they'll have patients with chronic pain get under this laser with chronic back pain, and we'll see they get all the wonderful benefits of the violet wavelength of laser, and they also dampen their pain in addition to dropping some inches of body fat. So it's multifactorial. How to use this for back pain or for gut support is you simply just put the laser around that area. I like to put another one on the brain and on the basic Dr. Berry settings, and you can really enhance function. Very, very easy to do. What does that look like? This is what it looks like here. So it's another slide you might want to take a little picture of. This is a doctor stacking the emerald along with an FX, along with a handheld laser in there as well too. So really lighten the patient up in a lot of different ways here. They've got it on the head and they've got it on the gut. So you could stack a Zerona or an Emerald or a VZ8 on there. I like to laser the brain on 110, 40, and 60 and place the other on the gut and maybe add vagus nerve stimulation or have the patient just go, or that'll stimulate the vagus nerve. And there's some settings we'll put on for the gut, 20, 96, 27, 96, and 69, 39. Very, very easy to do. This is showing it on a patient I had who he was a drowning victim, and he had chronic infections that were keeping me in the hospital 3 weeks out of every month. We were utilizing this to try to help him from, recover from the drowning. So we put it on the brain and on the gut as a nice side effect. He went 6 months without having any infections and having to spend any time in the hospital. Now, what did we do? We used the same frequencies I showed you in the previous thing, the same frequencies for sports performance enhancement as well, which was the 1, 10, 40, and 60 on the brain, and then the gut or immune settings over the gut. Very easy to do. Now, this is an important slide to share with your patients too, because as red light therapy is getting more popular, some patients are going to mistakenly think you're just doing red light therapy. And it's important for you to tell them, no, this is not red light therapy. This is laser therapy. And there's Dr. Trevor Barry with his patient, Danica Kirkpatrick. And the reason why this is important is this. When we look at red light therapy, that's the dotted line. You see that it helped while the patient's receiving the therapy, but then once they stopped receiving it, you see that their pain started to come back. This is different than the laser, where the laser created long-term benefits, even at the 12-month mark. On average, even a year after they finished with these 8 20-minute sessions, their pain reduced by another 17.46%. So huge long-term differences. And then when we did this review of the literature paper, I was one of the co-authors on this. We wanted to compare true red laser to red light and to opioids and NSAIDs. Here's what we found. We found that red laser was superior to NSAIDs, to opioids, and to red light therapy. The average improvement compared to red light therapy was 6 to 7 times greater results with laser versus red light. Laser triggered long-term repair of tissues to create long-term reduction in pain. So if you're watching this video trying to figure out, do I go with red light or do I go with a laser? I think red light is great for patients to use at home. It's inexpensive, it's fine to use there, but you can't match the results that you get with a true laser. And this is backed up by double-blinded, randomized, placebo-controlled studies. So the GVL, this is the green and violet highest energy FDA cleared laser. This is the one Dr. Silverman and I were co-authors on. And we saw great results. Our paper got published in a peer-reviewed journal, which this is huge. Only about 12% of papers get accepted. And what I want to show you here is I refer to these lasers, I don't call them low level or cold lasers anymore. I call these high energy lasers, high energy non-thermal. That's what you want to be using out there. Create that as the buzzword to show that these are different than the other devices that are out there on the market. Patients understand that better. And again, when we look at the comparison of the dual red laser, red and violet, green and violet versus a red light therapy device, all of the lasers blow away the red light therapy device. But the green and violet, if you look down to the bottom where it says percentage improvement in pain from study endpoint to 40 hours post-treatment, that's where the green and violet and red and violet really separate themselves. 48 hours after treating with the Accelerate, there was still a 43% reduction in pain. With the red and violet, it was 50%, and with the green and violet, it was 65%. So they had the biggest impact even as time goes on. Whereas with a red light therapy device, there was no improvement. Their pain came back on there. And we look at how many percentage of patients in the study, they had to have a minimum of 5 years of pain, minimum of 5 out of 10 of pain. The number of patients who got at least a 30% pain reduction with the Accelerate was 65%, 75% with the EVRL, and 81% with the GVL. Really, really high. So if you're looking at a handheld to add, that's a great one to do. With red light therapy, it was only 11%. And percentage improvement in range of motion, only 2% with red light therapy. The Accelerate, the dual red was 14%. The EVRL was 29%, and the green and violet was 32%. So this is what my basis is for recommending you. If you're going to choose one handheld, if you can afford it, go with the green and violet. If not, start with one of the others and plan on upgrading either to trade it in and get a red violet or a green and violet, or upgrade and do the base station. That's a great way to do it. So what's our protocol for chronic shoulder pain? We did 6 minutes per shoulder. Had the patient do little small movements in the pain-free range of motion. You can use these settings. These are the chronic pain settings: 8, 25, 42, and 279. For best results, I like to stack the EVRL into the FX like I showed you on those earlier pictures with Ian Somerhalder, or you can just surround it with the FX like this, and then you pop that GVL in at the same time. So you can literally do this on day one out of the box. The biggest problem I see doctors do is they overthink the lasers, and they think they have to like know everything before they start using them. Just get it on the area, do small movements in the pain-free range, and you're going to help a lot of people. That's where the base station can be very beneficial if you don't want to, if you can't afford to do the FX, is do the base station where you're getting three lasers for a little more than the price of two, and then you can have them at different stands, multiple wavelengths or colors on that area, and having the patient do movements or on the area and the brain at the same time. And you can also do rentals with these. We have other webinars you can see on how to do the rentals, but that's a great passive income stream that helps out patients a lot. So how about if you got chronic heel pain and plantar fasciitis? This is a very easy one to do. These are 10-minute protocols. We usually do twice a week for 3 weeks on here. And it looks as easy as this. You stick the laser around there. You can stack other therapies if you want, like a percussor or like a scraping tool, or get in there with your hands, do your adjustments. But with this alone, you're going to see some nice benefits. And all you have to do is you push the button. Just make sure you do this. And there you see there's the heel pain protocol. You just push the button. Make sure you assess them pre and post. Have this patient squat, have them lunge, have them try to walk, check out their pain, then do the laser and immediately reassess them. That's where most doctors make their mistake, is they're not doing any pre and post assessment. You want to treat this with your new patients kind of like we do when we're doing the FDA clearances. We want to get some outcomes assessments. Here, long term, we can see again 12-month benefits. They're better at 2 weeks post, they're even better at 6 months post, and really great at 12 months post on there. Be sure you join in my group here too. We're at over 2,100 members here, where you can ask questions in that group too. Even if you don't have a laser, come in there and kind of lurk in there, ask some questions of some of the doctors. We got a lot of doctors who have been using lasers since even the 90s and the early 2000s that are happy to share tips with you. And don't forget, you also got Jamie Thayer's group, the Zerona Glow Your Business. That's great if you're looking at adding in the VZ8 or the Zerona or the Emerald. And I also have my YouTube channel over here, which I have more videos on there, videos about the VZ8, and especially about there's certain things we can't talk about in the Urconia webinars here. We have to stick more to what is FDA cleared. But on that page, I can talk about a lot of other things. So if you look at my video on the VZ8, I can go into a lot of the off-label types of uses. Same thing for the FX and the other types of lasers on there. We can do a lot of different discussion on different kinds of treatments that we can do. So the question doctors always have at this point, you see how easy it is to stack these lasers together. Your optimal combination to do for the lasers is if you can do an FX plus a GVL. That's going to optimize your results. And ideally, if you can do an FX plus a base station, because then you can have multiple lasers for multiple rooms. You can also rent lasers out so you get additional revenue streams, which we generate a little over $2,000 a month just in our laser rental business. So that's very, very easy for doctors to do. It's in high demand. Patients really want it. With those ones, you can do, especially if someone's going in for surgery or for dental work, you can do pre-op, you can do post-op types of things. The patients will usually rent it that week beforehand and rent it for several weeks afterwards. Maybe like we'll do a 1 month rental 1 week before they go in for the surgery, and then for 3 weeks afterwards. So that way they can really enhance their recovery. They also, when patients have done this, they're less likely to get infections because they've got that violet wavelength laser that is helping support the immune system. And again, when doctors are thinking about like some of the Zerona devices, sometimes they think, well, I don't know if I'm going to do just a lot of body contouring. I don't know if I want to do that. When we're looking at these things, like especially with the VZ8 particularly, that has a great ability to decrease pain. So it's almost like having another FX in your office, but now it's an FX that has 8 violet rotating diodes. So you get an amplified effect on that tissue. And what I've heard from doctors across the US as they've been implementing this is that we're seeing improvements not only with that, but also with gut function, because you got to remember that that violet wavelength laser has this big impact for supporting the microbiome and helping to try to repair that. So with that, that's going to wrap up this portion of the webinar, and this is giving you an overview of all the different types of devices that are out there, unique applications. I want you to really remember as a takeaway from this is that don't overthink the laser. I've had some doctors show up to seminars before that have had their laser in a box for 6 months. I had one doctor come to a seminar whose laser had been in a box for 5 years. And he said, well, I really want to just understand this more before I start using it on patients. I've shown you it's got the head to toe FDA clearance, shown you it supports the mitochondria function. It dampens inflammation. You're going to stimulate brain-derived neurotrophic factor. You're going to stimulate glutathione. You're going to dampen inflammatory cytokines just by getting the laser on there. So your basic thing that you want to do is get the laser on whatever area it is and stick it on there for somewhere between 5 to 20 minutes and let the laser do the magic for you. The other thing, if I'm going to go back here, let's fly back here. I want to show that setup again of this basic setup when we combine the FX and we combine the say a GVL or combine an FX and a VZ8. This setup, you could create an amazing clinic by doing nothing else than putting a laser on the brain and a laser on the gut. You do that, you're going to help a lot of patients. You're going to dampen inflammation. You're going to support that bidirectional gut-brain communication access. So if you do functional medicine, this will enhance your functional medicine practice. If you do functional neurology, it will enhance your functional neurology programs by just utilizing these things. Have the patients coming in weekly or twice a week. This is part of what we do for performance enhancement, whether it's for sports performance or overall just feeling better each day of your life and feeling more energetic. Simple setup. Any of you can do this for day one. If you want to learn the more complicated the strategies, like what I call my Jedi neuro recalibration, be sure to take a look on the Urconia website at urconia.com and look for the upcoming seminars. And be sure to come out. Dr. Robert Silverman and I are going to be doing one soon. Trevor Barry and I are going to be doing one. Dr. Dan Murphy and I are going to be doing them. And anytime you see me there, I'm going to do a lot of hands-on with teaching you how to reset the nervous system very, very quickly. So at this point, I'm going to wrap up my section and I'm going to turn it over to Urconia to tell you about what kind of specials they have going on this month.